Guillain-Barré syndrome. By Daisy Gaston, RN, BSN. What is it? Guillain-Barré syndrome is a serious disorder that occurs when the body's defense, immune, system mistakenly attacks part of the nervous system. This leads to nerve inflammation that causes muscle weakness and other symptoms. Grossman and Port, 2014. Who discovered it? Octave Landry is credited with the first reported case of what later came to be known as Jeeves. In 1859, Landry described a neurologic condition characterized by ascending motor paralysis with poor prognosis that he referred to as ascending paralysis, aka Landry's paralysis. Afifi, 1994. Figure 1. Octave Landry. Adapted from Wikipedia, retrieved from http://n.wikipedia.org/wiki/gene_Landry_physician. Who discovered it? Later Guillain-Barré syndrome was coined by the French physicians Jean-Alexandre Barre, Georges Guillian and André Stroll in the early 1900s following tests on soldiers returning from World War I. Many cases of an identical condition had been described over the preceding 80 years, but these neurologists identified one of the characterizing features of the disease: the increased concentration of protein in the spinal fluid without evidence of inflammation. Afifi, 1994. No one knows why Stroll wasn't included in the naming of the disease. Figure 2. Guillain-Barré, Stroll. Adapted from http://www.wikipedia.org. Pathway to disease. Upper respiratory infection or gastrointestinal infection often precedes the onset of Jeeves. All forms of Guillain-Barré syndrome are autoimmune diseases, due to an immune response to foreign antigens. Ascending paralysis ensues as the disease progresses. The end result of this autoimmune process is an attack on the peripheral nerves and damage to myelin, the fatty insulating layer of the nerve, and a nerve conduction block leading to muscle paralysis that may be accompanied by sensory or autonomic disturbances. Guillain-Barré, unlike disorders such as multiple sclerosis, MS, and Lou Gehrig's disease, ALS, is a purely peripheral nerve disorder and does not in general cause nerve damage to the brain or spinal cord. Capel, 2013. Can mimic these diseases, so do a proper patient history and workup. Signs and symptoms. The disorder is characterized by symmetrical weakness that usually affects the lower limbs first, and rapidly progresses in an ascending fashion. Patients generally notice weakness in their legs. Numbness and tingling may or may not be present. As the disease progresses, the arms and facial muscles become affected. Bulbar weakness or oropharyngeal dysphagia, drooling, difficulty swallowing or difficulty maintaining an open airway. Facial weakness. Respiratory distress may require ventilation. Sensory loss, proprioception and areflexia are important factors of Jeeves. In severe cases of Jeeves, loss of autonomic function is common, manifesting as wide fluctuations in blood pressure, orthostatic hypotension, and sinus tachycardia among other cardiac arrhythmias. Capel, 2013. Scary stuff. Well, kinda scary. Can happen really fast. Post-infection, the disease can progress within days to cause severe symptoms. Sometimes hospitalization is required if the inflammation moves to the nerves that are in the diaphragm and breathing is being affected. Don't worry though too much. Only about 1.65% to 1.79% per 100,000 people a year are affected. And only 3% of those percentages is fatal. Recurrence rate is only about 3%. Capel, 2013. Risk factors: men greater than women, infectious agents such as Campylobacter jejuni enteritis, most associated, Koga, 2006. Epstein-Barr virus, cytomegalovirus, mycoplasma, HIV, influenza, systemic illness, i.e. Hodgkin's lymphoma, SLE, vaccinations. Capel, 2013. Interesting fact: following the 1976 H1N1 vaccine, there was an increase in the reported incidences of Jeeves. Studies showed that there was a link, although small, associated with that particular vaccine and Guillain-Barré syndrome. In response to the 2009 H1N1 scare, there was obviously a curiosity in the link, and a study was done to show that there was still a small, but measurable risk, with the PH1N1 vaccine and developing Jeeves, Wise, et al., 2012. But the benefits far outweigh the risks of not getting the vaccine, so therefore was deemed not a significant risk factor to not getting vaccinated. Diagnostic and testing. The diagnosis of Jeeves depends on findings such as rapid development of muscle paralysis, areflexia, absence of fever, and a likely inciting event. Cerebrospinal fluid analysis, through a lumbar-spinal puncture, and electrodiagnostic tests of nerves and muscles, such as nerve conduction studies, are common tests ordered in the diagnosis of Jeeves. CSF characteristic findings include albuminocytological dissociation. As opposed to infectious causes, this is an elevated protein level, 100 to 1000 mg/dl, without an accompanying increased cell count, absence of pleocytosis. A sustained increased white blood cell count may indicate an alternative diagnosis such as infection. EMG and nerve conduction studies may show prolonged distal latencies, conduction slowing, conduction block, and temporal dispersion of compound action potential in demyelinating cases. F waves and H reflexes may be prolonged or absent. Needle EMG is frequently normal in acute cases. Reduced neuropathic recruitment in weak muscles can be seen. Fibrillations will be seen on needle EMG if some maximal injury occurs after 3 to 4 weeks. In primary axonal damage, the findings include reduced amplitude of the action potentials without conduction slowing. Grossman and Port, 2014. Treatment. Supportive care is the cornerstone of successful management in the acute patient. Of greatest concern is respiratory failure due to paralysis of the diaphragm. Intubation may be needed when evidence of impending failure of the muscles of breathing is present. Subsequent treatment consists of attempting to reduce the body's attack on the nervous system, either by plasmapheresis, filtering antibodies out of the bloodstream, or by administering intravenous immunoglobulins, EVIG, to neutralize harmful antibodies and inflammation-causing disease. These two treatments are equally effective, and a combination of the two is not significantly better than either alone. Grossman and Port, 2014. Patient teaching post-infection. Manage psychosocial aspects of Jeeves, anxiety, education. Full recovery may take up to 2 years with strict adherence to rehab regimen. Support groups may be beneficial. Capel, 2013. A picture is worth 1,000 words. In conclusion, a picture is worth 1,000 words. Questions. 1. A 28-year-old male comes to you complaining of profound weakness and numbness in his feet that he said has seemed to get worse, and moving up his legs. He just got over a really bad stomach flu a few days ago. You may suspect A. B12 deficiency, B. Bad sushi from downtown Savannah, C. Guillain-Barré symptoms, D. The feeling you get right before you take a patho test. Questions. 2. Guillain-Barre symptoms can be life-threatening if not treated promptly and correctly? A. True. B. False. Questions. 3. Guillain-Barre syndrome is a demyelination of the myelin in A. the central nervous system. B. the peripheral nervous system. Questions. 4. Which medications are used to treat Guillain-Barre syndrome? Check all that apply. A. Doxycycline. B. Ivig. C. Plasmapheresis. D. Supportive therapy. Questions. 5. Who is your favorite South University professor? A. Dr. Seuss. B. Dr. Gupta. C. Dr. Mokoko. D. Dr. House.